Ehlers-Danlos syndrome is a genetic connective tissue disorder that causes weakened collagen, which is your body's glue. So it is considered rare, but it's more common than is realized because it's often underdiagnosed or misdiagnosed as things like fibromyalgia and stuff, even autoimmune disorders. So Ehlers-Danlos presents with hypermobile, loose, unstable joints that easily dislocate and sublux and injure, and soft, sensitive, fragile skin that is often elastic. So, but it's about so much more than that. And it is one of the most neglected conditions in the world. Several healthcare systems neglect Ehlers-Danlos syndrome, neglect people with Ehlers-Danlos syndrome, deny Ehlers-Danlos syndrome and don't even give a diagnosis. And even when a diagnosis is achieved, people have trouble getting care. And people, develop trauma, psychological and emotional trauma, which makes their health worse when we already have a health problem. So it really doesn't help for many reasons to continue to neglect and treat Ehlers-Danlos patients so poorly. And people need to know that this is happening in several medical systems around the world. So Ehlers-Danlos syndrome causes all kinds of complications with the heart and circulation, digestive system, immune system, spinal cord. It's really complex and it's different for everyone, but there are similarities, just like there are with lupus or MS and that sort of thing. We need more awareness. Doctors need to be willing to educate themselves, because when you neglect Ehlers-Danlos, it leads to developing worse complications and really a lot of suffering and poor quality of life for patients. So, collagen's everywhere in your body. So it's in your organs, it's in your gut, it's in your spinal cord, obviously, it's in your everything. And so when your connective tissues are weak like that, all kinds of problems can happen. So what's with the weakened collagen? Well, Ehlers-Danlos syndrome is thought to be possibly, it's genetic, and it might be an offshoot form of mitochondrial disease that happens to affect the collagen. So when the collagen is dysfunctional and weak, you get veins that are elastic and stretchy, and circulatory dysfunction, and you get digestive problems, difficulty with motility and absorbing. You have problems with infections because the tissues are too soft, and anywhere sort of gross where it's warm and mucousy and stuff are more prone to infections. The urinary tract, all kinds of Stop it, guys. You stop that. Isabel. Bad girl. Time out, Isabel. Time out.
Izzy,
she just freaking attacked Daisy.
Yeah.
I'm trying to Okay, I'll have to edit this out. I'll be there in a sec. I'm just trying to make a video. So there are ways to treat Ehlers-Danlos when a physician is educated. Right now here in Canada, healthcare is way too compartmentalized, and a GP or family doctor will try to refer an Ehlers-Danlos patient to, say, a GI doctor. And oftentimes the GI doctor will see that the person has Ehlers-Danlos and they'll turn them down. They will not, they'll reject the referral, which they shouldn't even be allowed to do, because, people need care. So the GP is often left to try and help the person manage, and the person has to do a lot of research, and a lot of the weight and the responsibility falls on them. Oh, hey, I think I need this thing. I think I need these antihistamines. So people with EDS develop like comorbid disorders like dysautonomia, which is, dysfunction of the autonomic nervous system, especially a condition called POTS. I have that. Orthostatic tachycardia syndrome, where the heart rate is going too fast, often treated with beta blockers and fluids because we easily dehydrate. We need care. We need multidisciplinary care, but instead we get rejected by specialists and left to kind of fend for ourselves. And people end up sort of eventually drowning, like me and like the lady that I'm going to link an article to another woman who has applied for medically assisted death, who has Ehlers-Danlos and who is just, 89 pounds and at her wit's end, overwhelmed, sick, only in her late 30s. Like, this is a common scenario. I'm 36. I'm almost, near always bedridden from neck instability that isn't being treated, or, I can't get the surgery I need right now in this country. Like, we shouldn't have to suffer like this. I feel like I want to compare this to if, doctors treated cystic fibrosis with neglect. If they said, oh, well, you have a genetic problem anyway, you don't need the lung treatments, forget about the lung transplant list, go drown. Ehlers-Danlos patients have a genetic disease that needs care, but we're drowning. We're being discriminated against. Doors are being shut in our faces. And people have to travel and pay out of pocket to see the few specialists who are willing to treat EDS, and then they go back to their family doctor and say, so-and-so in the States said I need this and that, and then the family doctor keeps prescribing it. But not everyone can do that. I've literally had to fundraise just to do that. I can't fundraise for my neck surgery. It's too expensive. I have a fundraiser right now. It's not growing yet in the way that's needed to afford the surgery. I'm trying one last avenue, which I mentioned in the other video. But anyway, I've had to fundraise just to get like basic care, just to get opinions from doctors who specialized in it for systemic issues. And then I go and say, I need this and I need that. We shouldn't have to do that. We should be getting care in our own system, and we're being excluded from that, and it's not okay. And because we're being excluded, a lot of us can't afford to do that very often. So the more limited we are in going outside our system to get the care we need, the more we're going to suffer and have less answers. We may not know we have a certain chronic infection. Chronic infections are a big problem for EDS because of the tissues being so soft and fragile. I think I might have mentioned that already, so I'm getting tired and I might be repeating myself. But, we might not know about certain complications that are like draining us that could be treated because they can't do the tests here. A GP can only do so much. And when specialists reject you, you're stuck suffering on your own. And I've dealt with so much of that, and people end up burnt out, especially when they're low income. They say, I can't do this anymore, and family relationships suffer, and people end up in care homes and, with shortened lifespans and really poor quality all the way down. Like, the horror stories are immense, and it's all under the rug, in the shadows. And I want to speak out about it because this is happening. If people don't have the money to treat Ehlers-Danlos, they really get the short end of the stick here. And I'm not trying to pit, wealthier people against lower income people, but wealthier people at least have the privilege of being able to treat their rare condition, by getting care from the privatized doctors that can offer it and paying the money for travel to get to it. But not everyone can do that. And we don't have a voice, those of us who can't do that. And then there's the middle class who, they can do it, but they get into debt. They have to take a second mortgage out on their house, and they're in debt to get what they need. and when we're supposed to have a free healthcare system, or complimentary or whatever, and people with who are low income can't get it at all and just suffer and become bedridden and in pain, and all that we can do is just take drugs. Like the woman who is in the article who's applying for medically assisted death, who has Ehlers-Danlos, is opioid dependent, as am I. And I don't want to be opioid dependent, but I have no choice, and it is messing up my gut and giving me negative side effects, and all of it's just killing me. And I don't want, when I say that I want I've considered medically assisted death, it's because I don't want to keep suffering like that. It's not going to get better without intervention. So things need to change. There needs to be care for us. It's not okay. We are being excluded. Canada's on the wall of shame. So are many other countries. If you're living in a different country, I know the UK has problems with care, and I know people in Ireland who are really suffering badly, and people in England. I think it was there's people in the Netherlands and that I've heard are suffering. So I'd like to hear from you if you're, I would like to hear your experience if you relate with this, or if you know someone. And if you don't, please hopefully take this in and be another person who knows about Ehlers-Danlos and knows that we're not getting what we need, and that we're being neglected, and we're being soft killed basically, and suffering all the way down.